why not?
Why not?
That's what life's about.
Exactly. Why not feel amazing in your body? Yeah.
Yeah. Embodiment for me means feeling at home in my own skin. And it's not just the absence of a negative feeling, but it's also the presence of a positive one. So for me, being a person that struggles, and I would say this is an ongoing thing with body image, and like I said, I've lost 100 pounds 3 times, meaning I've regained it 3 times as well. It was feeling like this is my home, and I celebrate it, but I also, there might be certain aspects of my home that I wish were different, but this is where I belong.
Right.
And to me, that's what embodiment is.
Do you remember what it feels like to be comfortable in your own skin? Not just confident, but also pain-free, relaxed, healthy, and carefree. Think about the most robust version of your own childhood body. This is what Lifeyness feels like, a joyful spirit and a vibrant physical state of being. I'm your guide, Professor Sara, storyteller, teacher, and wellness enthusiast. Reach into the vitality of your own girlhood to supercharge your grown-up life.
Hello, and welcome back to Lifeyness. Today we're going to be joined by Dr. Sara Sohn, a pelvic floor physical therapist, a sex counselor, and a mentor for health providers and coaches in the field of sexual wellness. So, of course, we'll be talking about embodiment, and this time, sexual wellness. Sexuality is not something that we've really talked about on the show that much. But as we discuss in the interview, it's interesting how we can talk around that in so many different spaces, even on a podcast about embodiment. So sexuality is a big part of embodiment. But this will really be my first episode focusing on sexual wellness. So Dr. Sohn and I met several years ago, before I think she even started her business. We were both swimming with a group here in Jacksonville called the Open Water Duval Swimmers. It's just a group of people who love to swim, and they love to swim outdoors in nature. So it's fitting that we met in a place that made us both feel happy, embodied, and in nature. So as I said before, Dr. Sohn is a pelvic floor physical therapist and sex counselor. As the founder of the Sex Certificate for Providers and Confident Pelvic Rehab, Dr. Sohn has established herself as a leading expert in pelvic health for all genders. Today, she's going to talk to us about her experiences, her practices of sexual wellness, and she's even going to guide us on an embodiment practice of her own that helps her clients. She's going to tell us a little bit about what her practice does and what she does for health providers. And she's going to talk a little bit about her own personal journey and how that brought her to her specialty. As she'll tell us, Dr. Sohn was raised by an OBGYN. Her mother is a physician. And so she's been around this kind of stuff her whole life. But as she will reveal, it took her a long time to kind of really get embodied when it came to this kind of thing and understand it in a more transformational way, as she says. One of the things she wants to let listeners know is that they are not alone when it comes to pelvic floor issues or pain. Her mission is to kind of create a safe and open space for discussing all aspects of sexual satisfaction. So like here, she's going to be talking about enhancing pleasure, exploring, but also feeling safe. She invites listeners to connect with her at her Facebook group, She shares, for free, a lot of insights and tips and resources with a lot of care and compassion, as you're going to see in this interview here today. So thanks for joining us, and please reach out to me at Book of Lifeyness on Instagram, and you can reach Sara. She is in the Jacks Beach area. Her email address is in the show notes, but she also has a Facebook group called Better Sex by Sara, and that's Sara with no H. So please welcome to the show, Dr. Sara Sohn. Well, thanks so much for joining me today on the podcast. This is great. Going back kind of before you became a physical therapist, how did you get into this, like how did you find this calling and this very specific niche?
Well, I've been around taboo topics my entire life. My mom's actually an OBGYN, and it's interesting because we never had a conversation about sex. And then I went to school to be a physical therapist. I became a pelvic floor physical therapist, where I specialized really in people having pain or incontinence and different issues with those muscles down there. And I still never had a sex education class, even though I was a specialist in pelvic pain disorders. And so I went to school for sex counseling and sex education. And I learned that so many people are just thirsty for that knowledge. So now not only do I have my own practice, but I also want other health providers and coaches to enjoy their work as much as I do, when you get to help people with that full picture, not just the physical pieces, but also the full breadth of sexual wellness, what people really want help with. So I needed that help myself. I needed some support. And even in all of the school that I had, it wasn't there. So I cultivated it. And I found myself going to many different sources to learn. So I would it was in school. I went to University of Michigan for sex counseling, sex education. I did pelvic floor therapy, all these things. But where I found so much healing was on my own sexual wellness journey within kink and going to different places. And so I wanted to combine all of those different little siloed areas and say, there's a place where we can all be learning from each other and grow together.
That's so interesting. So you were it was almost like a parallel journey where you were doing this, you were doing the academic work, but you were also on a personal journey. Were you going there for healing, or was it just kind of like your own little personal adventure, or was some of it you needed healing, from different things?
I'm a person that believes those things go together. I don't think we have to be healed in order to experience pleasure or to have adventure, novelty, and wonderful, pleasurable experiences. And I also think that healing can be a part of the journey of novelty. So looking back at it now, I was looking for both, but I didn't know that at the time. I was really simple. I was just a person that was looking to have great sex and to feel good in my body, to feel not even neutral in my body. There are certain parts of my body, like my stomach, that I was conditioned to not like. I'm a person that's lost 100 pounds 3 times, and I wanted to feel comfortable with my naked body. I wanted to date. I wanted to flirt. I wanted to have great sexual experiences and feel like I could be myself when I was with around other people. I wanted to feel more home in myself, my body, my mind. And so, I was a mixture of healing and novelty and adventure. And why not?
Why not?
That's what life's about.
Exactly. Why not feel amazing in your body? Yeah.
Yeah.
So when I say embodiment, I think people think different things. For you, what did that journey look like, becoming more embodied versus maybe feeling disembodied before that, or not feeling comfortable with your body? What does embodiment mean for you?
Embodiment for me means feeling at home in my own skin. And it's not just the absence of a negative feeling, but it's also the presence of a positive one. So for me, being a person that struggles, and I would say this is an ongoing thing with body image and like I said, I've lost 100 pounds 3 times, meaning I regained it 3 times as well.
Mm-hmm.
It was feeling like this is my home and I am neutral in it. I
Mm-hmm.
celebrate it, but I also, there might be certain aspects of my home that I wish were different, but this is where I belong.
Right.
And to me, that's what embodiment is. And it's so much of my professionalism and my own personal experiences go together, because I also would help people that had the same desires. They weren't feeling comfortable in their body particularly with sexual experiences. They weren't feeling like comfortable being naked. They weren't feeling, maybe they were experiencing pain. And I didn't feel like I had the tools, not just for myself, but also for them to say, it's not just these physical things. It's not just being able to have this one type of sex that we want, but to feel comfortable and feel at home in our body during those experiences.
Mm-hmm. How do you get a client or a patient to get to that point? Like, it's so hard. You can't talk someone into embodiment, right? It's a combination of different things, I'm sure. Because some people don't even feel good being aware of their bodily sensations, right? Like, is that I guess that's a coaching process, right?
Well, I have a lot of different somatic healing tools. So I could say that, but really it's more of the bigger picture. So the way that I look at sexual wellness, and I created a little acronym that I'm very proud of.
Yeah.
SEX stands for safety, eroticism to E, and then the X is exploration. So feeling safe in your body is cultivating what feels safe in your body, even if you're still on a journey. Like, you don't have to be fully healed in order to feel safe and erotic in your body. So cultivating what that is for you. Eroticism is, we might have this image of what eroticism is, and maybe it looks like lingerie and, oh, I just don't feel good in that. But for you feel really erotic when you're wearing loose clothes and your hands in dirt and you're gardening, right? So it's
right.
Like, what is your erotic footprint? And then how do you explore that with someone else or even within yourself and allow that to change over time? And to me, that's an embodied person that's having great sexual experiences, as they feel safe, they feel erotic, and they are able to explore. And so there's a lot of different tools that we'll use and we cultivate over time, but that's kind of the way that I look at it from the beginning, is how do we first cultivate safety, then how do we cultivate that erotic blueprint, and then how do we cultivate exploration for those things.
I love that. That's such a great acronym. That's so good. Yeah, and I love that the safety comes first, because you have to have safety before you can have the other things. That's really cool.
Exactly. And this is what I teach, health providers and coaches too, so that they have the tools to help their clients, because so much of sexual wellness is not information. We can go online and we can look up anything about sex that we really want to. We are overstimulated with information. We're sex obsessed culture is the word that I say. We're overstimulated when it comes to that. But we're not one that knows how to take that information and how to help someone. It's not just information, but transformation. So how is it transforming that person uniquely and ourselves? Or I think that starts with ourselves, actually, and then integration into their life. So that's where I look at my own role. It's not just information, but how can we uniquely help you transform and integrate that into your life? And it starts with me. I mean, I practice these things. Right before this call, I was leading a call with a bunch of different providers where we were bringing our questions, we were bringing our vulnerability of how a certain experience made us feel. I go on dates. I'm always trying to learn more about myself, my own safety, my own eroticism, my own exploration, so that I can help someone transform and integrate that into their life.
Yeah. Yeah, it sounds like you bring your humanness to your practice, rather than it just being like a clear line between the medical and the personal. It's like that's not really how life works. so I'm sure that's really helpful for your clients.
Yeah, I think it's.
I'm sorry. Go ahead.
I think when you're doing something you're really passionate about, that becomes easy because you are your work and your work is you. Like my work changes me as a person and I am my work. Like I am the person that, it's not just something that I do and talk about. Like I really believe in pelvic health for every single person. I really believe in sexual wellness for every single person. And I really believe in leading in this area. Because the best leaders are the ones that are embodied, themselves, that are living their truth themselves.
And I think what you said about information, that we're this culture, we have too much information and probably too many images of sex, right? We have that barrage all the time of the images and information. And then what you said about transformation, that's kind of the embodiment piece. If you think about it, it's like there is no amount of information that you can read or porn that you can watch or whatever that will make you feel on the inside, like in your body, kind of like different or, kind of to let you know what healing feels like. So we don't have that access unless you turn into yourself, like you work with yourself in your own body. You won't be able to go on that journey just with information. So that's interesting how there's that connection between transformation and embodiment. You can't do the transformation unless you're feeling into your body.
100%. And that could be really scary. This is the sex obsessed culture where knowledge is silenced and siloed, meaning that we are sex obsessed. It's like constantly on our mind, but we're a culture that silences the idea of having these conversations and we silo them. This is not appropriate right here. We can't talk about it here.
When clients come to you for healing, right? Like I'm sure they come to you for different reasons. How do healing and embodiment go hand in hand? It's like I've said here, even, in this space, I talk about embodiment and bodies and yet how have I not talked about sex really at all? Because I think you're right. That's what we do. We like silo it. It's like, even though we're sitting here in these erotic bodies, we ignore it easily. So, how does being in your body heal you? Like from your perspective, how is that healing?
It's interesting because having the perspective of being a pelvic floor physical therapist first, and then going into sex counseling and then mentorship in that space really has changed my perspective, because in the medical model, pelvic floor therapists really learn about, if you can imagine like a target or a bullseye, where it's the absence of discomfort, the absence of pain. So let's say, I'm going to use an example. Let's say I'm helping a woman who is having pain with insertion. Every single time a tampon, a finger, anything that's inserted is painful. So if you imagine that the center of that would be, that's painful. And the outside of that circle is all the things that would not be painful, right? It's not painful to be touched here, or all the different things that person wants. And we can work on all those physical pieces and we can work on healing those things, but it's not the same target as a separate one, which would be what actually feels good in my body, right? Maybe that target is pleasure. I feel really erotic when I'm not feeling so delicate. Like someone's checking in with me, but it's not like, are you okay? Are you okay? Are you okay now?
Right.
Right. I feel really erotic when there's some novelty, there's some newness with role play, with fantasy. I don't have a genitalia at all. I'm an alien, whatever. Like how do I get in touch with those things? And so I realized that by only focusing on the absence of pain or those physical sensations of a body, I wasn't really helping a whole person. Because pleasure is nuanced. Pleasure isn't this siloed thing where we see one person to help with this and one person to help with this. We're a whole person.
Right. Yeah.
And so when I'm helping a client, to answer your question, I try, to help them with that whole person, not just the absence of discomfort, the absence of, oh, I wish I had more desire. I wish that I XYZ, but the presence of pleasure, the presence of, deconditioned shame, the presence of what is erotic to them and unique to them. And I help people on a one-on-one basis with those things, with that. And then I also help mentors in that area in a more group where we can all talk about it and how scary it can be to help someone with those things when you don't have the tools to do so.
Yeah, that's amazing. how common is it? I'm sure you work with a lot of like postpartum patients and things like that, but how common is it for people at some point in their life to have pelvic floor disorders or pain?
Yeah. So it's one of those things to say, someone say, am I normal? Right. It's like if you're leaking urine when you laugh, cough, sneeze, jump, if you have pain with insertion, if you have this dull, achy feeling, this heaviness down there, it's common, kind of like the cold, but we don't have to have the common cold. Right. Right.
Yeah.
Like so it's very common. It's not just in pregnancy, although that's a big population of who I see. All genders have a pelvic floor, and it can cause all different kinds of concerns. So sometimes people will say, it's ever since I fell right on my tailbone when I was a kid. I have this ache and behind my penis. It's not just people with vulvas. And or after in many countries, it's even standard of care to see a pelvic floor therapist just to prevent things like prolapse and incontinence and pelvic pain disorders later in life. So if you are a person that's struggling with these things, know that you're not alone. If you're in Jacksonville Beach, I do have a business here, but I could also give you for your show notes a link where someone can find someone near them, because once you I take for granted that this is what I do for a living. This is what I talk about every day. But a lot of people don't even know that there's help for these things and that they don't have to live with it. Right.
Yeah. And that there's other help beyond your OBGYN, because some of the things that you do are things that no doctor I've ever had really talks about. And it's not because they don't necessarily know about it, but it's just kind of like, it's not part of their practice. And if it's not part of their practice, then it's like there's no other way to find support like this.
Well, I want to change that. So if you are a physician listening and you want to help people with sexuality, please do reach out to me, because I do want to change that. That is a bigger problem. However, I always say it like this. My mom's an OBGYN, right? So I've been around that my whole life. Yeah. They're inserting a speculum and moving those muscles out of the way. They're saving lives. They're making sure you don't have cancer, cervical cancer. Right? That's not at all what I'm doing. But they're not focused on those muscles. And so a pelvic floor therapist is focused on the muscles that they're moving out of the way to make sure that those muscles affect everything. How we stand, we walk, we run, we cough, we laugh, we sit, we pee, we poop, we have sex. I mean, we take for granted how easy it is maybe to pee, poop, and have sex. And for some people, that's really difficult. I bet you weren't expecting those 3 words to be said in a sentence. This is my life.
No, I get it. It makes a lot of sense. I mean, it's a big part of what's going on down there, right? There's a lot of things. Yeah. Are there any like common myths or misconceptions that keep coming up again and again that you want to dispel?
Around pelvic health or sexuality, or both? Because yes. The answer is yes.
Choose. But yeah, let's start with pelvic health.
Around pelvic health?
Yeah, which I think one of them was just, it's like people ignore it. Like maybe if if you're not thinking about pregnancy and you're not, dealing with that, or if you're not a woman, like maybe you're not thinking about it. But yeah, what are some other myths?
Just that it's normal, quote unquote, to leak urine with age, that aging just means you're going to leak urine, or aging means that sex isn't going to be fun or pleasurable anymore. And that's not true. I mean, there are so many. And one for sex would be that there's this eternal the way that everyone has sex, which means there's a penis inserted to a vagina, and you do that for a long time. And then there's like fireworks that go off, and that's the epitome of amazing sex. You're supposed to have this orgasm at the same time, but you're not actually even supposed to like it. You're just supposed to do it, maybe. That's just not what people are doing. That's some of what people are doing, but there's a whole breadth of other things that sexuality is involved in. I spend so much of my job helping people to realize that so much of their desires and so much of their body is actually normal. Labia come in all shapes and sizes, penises come in all shapes and sizes, right? Like that oftentimes there's a lot of parts of your body that we've been conditioned to not like. And there's things that we can do to reshape our desire, not just for our partner or partners or whatever, but also for our own body.
Mm-hmm. Yeah.
Just a few. Don't get me on this high horse. I could just talk about this all day.
Well, sometimes it's nice to hear them out loud in a space like this. It seems like you work a lot with practitioners, right? Like that's a big part of your clientele is working with different doctors and things like that.
Yeah, I'd say, I have two businesses. So Confident Pelvic Rehab in Jacksonville, Florida, where I see clients one-on-one for sexual wellness and pelvic floor concerns. But then I also have Better Sex by Sara, and that's for practitioners and for coaches or anyone that wants to help people with these things, because I'm just so passionate about it. I'm an educator at heart, and I'm a person that has a lot of interest. We were just talking before we press record about how we swim together. I'm a person that has a lot of interest, that has a lot of passions. And so I just decided to do both.
Yeah.
So yeah, I do a lot of both.
Yeah. I'm really impressed by your business from what I'm sure I can just see the tip of the iceberg, but it looks like you're doing like a really good job, and the work you're doing is so important. So, okay. So there's two things I want to do if you're up for it. Like one of them is I want you to tell me a story about a client, if you have a story about just kind of like a success story. And the other thing is if you can walk us through an embodiment practice. So let's just start with the story. Do you have, someone who kind of went through your program or was counseled by you that's a success story?
I'd love to. I'm definitely not going to say anything identifiable, and I do want to change a few things about the story. So one of my clients had babies and felt kind of like a baby factory and just out of touch with their eroticism. So whenever they wanted to be having sexual experiences, it was like, this part of my body is for breastfeeding, and this person is my family. I don't want to have sex with my family, just felt so this lack of eroticism in their life, mixed with shame of not necessarily wanting to have those experiences. Yeah. And so we worked together for a lot of months on pelvic floor health, right? So feeling safe in their body. A big part of that was feeling safe within the physical body, right? So what pelvic floor concerns were going on, but also tapping into that unique eroticism. So finding what made them feel erotic, even if society says it should be different. And this person, a lot of different purity culture things were coming up in terms of the way that I describe purity culture is the idea of be sexy, but don't have sex, in quotes, right? So we're supposed to be sexy, but we're not supposed to have sex. And so we try to figure out how we can feel safe. She could feel safe in her body, what her unique erotic blueprint was. And we cultivated pleasure practice that felt really good to her, how to communicate that with her partner. We did some sessions with both of them. And throughout our time working together, really cultivated what that erotic sense of self was and what that erotic sense of self was together, to feel safe to explore together. And it was really wonderful to watch that blossom, to watch pleasure blossom between them in the bedroom, outside the bedroom, and to be a part of that journey. Yeah.
That's wonderful. So it sounds like you're a talk therapist as well as a physical therapist. So you have to kind of walk through a lot of those things that, a regular licensed therapist would talk about. Right.
Well, and I work in conjunction with licensed therapists. So I'm a sex counselor. So the difference being, a sex counselor is someone that is a medical provider. And so I'm not a sex therapist. And so there is a difference in the work that we do, but a lot of it is in talking and holding space for people. So there's an overlap there. And it is really lovely to be able to help some of the physical pieces, but also to hold space for their cultivating sexuality that feels really unique and good to them.
Right. Yeah. And it's this whole kind of emotional, spiritual thing that's, beyond the body sometimes, I'm sure. Yeah. So that's a nice segue to what I want to offer listeners. If you have something to help us at home, perhaps listeners, like, do you have any embodiment practices that help you get back into your body, get back into your sexuality, get back into that feeling and maybe beyond numbness? If I'm sure that you have some clients that feel numb and it's not necessarily a physical thing sometimes. How do you practice embodiment?
So I love Neo-Tantra, and I love somatic healing tools from so many different people. One that we can try together. Have you heard of the Golden Circuit? Have you done that one before?
No, that sounds fun.
So, if you're listening right now, I have a Zoom background where I'm standing on like a gold path that I made with, I think, what is it called? Discord, or not Discord? That art.
Is it like the AI art?
The AI art, yeah.
Yeah,
So
it's beautiful.
Thank you. So this is what reminded me of the Golden Circuit. So in Neo-Tantra practices, and Neo-Tantra just basically means like Tantra in the West, how we've made Tantra into its own embodiment practices, right?
So like Neo as a new Tantra, right?
Right.
Okay.
Yeah. And so one of the elements is circular energy. So the best way to do it is just to practice it. So what I'm going to have you do is just put your hand below your navel, a few inches below your navel, and everything is an invitation. So nothing has to be perfect. Mm-hmm. You can pause at any time. But I just want you to have your eyes gently closed or just open with a soft gaze. Just take a few breaths. Just see if you can step all the way into being here with me. This is only going to be a few minutes. And with your hand below your navel, I want you to imagine this gold light going from your hand down towards your pelvic floor, up your tailbone, to the crown of your head and back to your hand. And just check in, how fast is that moving? Is it like, whoosh, 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 or is it slow and steady? And as you continue to breathe, I'm going to be quiet now for a little bit. See if you can make that golden light slow and steady, going from your pelvic floor back up to the crown of your head, back to your hand. And see if you can pair that light circle with your breath. Inhale, breath, the light moving from your hand. Exhale, going to your crown and back to your hand. Maybe you can even feel that golden circuit every time it passes your hand. And knowing that you can put your hand on your navel here anytime and just check in. How fast is that golden light flowing? Can I slow it down and get more grounded into my body? And whenever you're ready, you can kind of move your body a little, shake it out. Open your eyes if they were closed, and give yourself a hug and a celebration for trying something different. You tried the Golden Circuit.
I love that. That's great.
This is, I don't think there's a one size fits all. I'm a person, if you can't tell, with tons of energy. So I personally love more movement oriented grounding activities. So I pick things for each person. But what I love about this one is that you can do it at any time. Mm-hmm. You just put your hand right below your navel and you can check in. How fast is that circuit going? can I make it more even?
Mm-hmm.
Can I ground myself?
Do you think, because I was imagining that going around and around, having it a little bit more even or just kind of like flowing is kind of where you want to be? Does that make you a little bit more calm versus, because at first it was like, and then it, I don't know, it just kind of like stopped at my hand. And then it was like, like a wave. But I like that. I loved the feeling of it just kind of going as like one circle continuously.
Yeah. What was your experience? Do you feel like focusing on it being more even and a flow helped you to feel more regulated in your body?
It felt calming for sure. And it's funny that you asked me if I've ever heard of it. I had not heard of it or heard it called that. But just the other day, I was reading a book called Neuroaffective Meditation by Marianne Benson. And she practices somatic experiencing and somatics. And it was that, but you started at the roof of your mouth. So her thing was like near your pineal gland, I guess, kind of like that's what you're supposed to be imagining in your brain. And it goes out of your mouth over, kind of like down your belly and under your pelvic floor and then kind of up. And it was the same thing. And that was just a few days ago. And I was like, oh, I love this. So it's so funny that you picked this one. Because
it's meant to be.
It was meant to be. It feels good. I like it. And I'm the same way. Like it's so hard to sit still and meditate. But anything where I can like imagine or do breathing exercises or kind of feel like I'm doing something, I think that works for me.
Yeah. And I love these somatic healing tools, but I do look at them as tools, right? So when I'm working with someone, as I get to know them, I cultivate tools uniquely for them. And then with my providers that work with me, they have a whole toolbox of here's all different kinds of different tools for different people, right? So I think the best practices is when you cultivate what's unique to you. And so if you're like, oh, this felt really good to me, I enjoyed this, then that's the thing to do. I know high achieving people, which I am one, I remember I was spending every day, I was like meditating like a monk for like 30 minutes because I felt like it was something I was supposed to do. And I did not like it. It was not helping me personally. And so sometimes when we start doing the thing that we feel like is a checkbox activity, we're like, oh, I should do this. So I'm doing it. And it's not actually benefiting us.
Yeah.
It's okay. It's like permission to find something else. Like there's so much out there that could be grounding and healing and help us to feel more at home in our bodies. And that might be one for you. And if it's not, just let it go.
Yeah. Well, do you have other resources or books or anything? I want to ask about your own programs, for listeners, because there's a lot of listeners in this area who could benefit from that. But just generally first, are there other resources and books where listeners can find other exercises and tools?
Not only do I have books, I have a book club where we read a book like this, like on a topic like this every month. So if you're a person that wishes you read books and feels comforted by having stacks of books, but you don't actually read them, you could just come to my book club and it's free. And each month I put the recording of the book, you get a whole resource and a whole list of the book. So I can give you that link so people could join the book club if they want to. Like I said, it's free. And it'll have a whole list by category of books and resources that I recommend for somatic healing, for neurodivergence and sexuality, like for so many different topics. So if you're a resource person, I got you. So I can give you that link. And a really great way to start to get some of those things is to just join my Facebook group. If you're a Facebook user, I have a group called Better Sex by Sara, Sara. And I can give you that link as well to share with people. And I have a lot of free resources in there. All the recordings from the book club are also in there. And that would be a great place to start with somatic healing if you'd like, if that's your interest.
I love the idea of self-healing. So the things that you can do on your own, I find that so empowering. But it's so awesome also to have a resource like you as someone who can talk, and be there and, hold space for a person. So if a listener is looking for that in this area, and maybe you do sessions online as well, I'm not sure, but where can they find you and your resources?
Yeah. So the best way to start, I'll send everyone to my Facebook group.
I'll put it in the show notes.
Yeah, you'll get contacted with me directly. If you're local in Jacksonville and you need one-on-one support for pelvic health or sexual wellness, or a lot of people come from out of town, and I do telehealth actually twice a week. So a lot of people I see the mix of telehealth and in person and those kind of things. It's confidentpelvicrehab.com. And then if you're a provider and you're wanting to learn more of these things about pelvic health, sexual wellness, all that, it's bettersexbysara.com.
Okay, great. Wonderful. And are there any programs coming up that you want to talk about? Just anything new in your world?
Yeah. So will this be out before July 19th?
It will not, no.
Okay, because I have a free workshop there. I do free workshops about once a month or sometimes a little bit less. So I have that free workshop that.
But I will promote it on my Facebook page. I have a new kind of Facebook community, so I'll start doing that. So definitely give me that information for July 19th.
Okay. Yeah, so I have a sexual wellness leader workshop. That's July 19th for anyone that wants to lead in this space. And then just staying on my email list, getting in contact with me on Facebook. I'll make sure you're on my email list. I'm always doing events all over the country and different talks. And so I'll make sure that you get the next thing, the next workshop, the next thing. I do that book club once a month. I'm launching the sex certificate for professionals, and we're even going to go to Paris together because to celebrate the end of it, that's going to start soon here. So that's exciting as well. And then I am taking clients one-on-one in Confident Pelvic Rehab. So I'm here, I'm available, I'm easy to talk to. And it's genuinely me if that's returning a email or that's responding to on Facebook. So just feel free to reach out. On Facebook, it's Sara, Sara Sohn, Sohn.
Okay. Yeah, and I'll have all the links, so it's easy for listeners to find you. But thank you so much for joining me today. This has been great. And just little tidbits that are just so helpful for people who may not want to ever even talk about this. Maybe they listen to this, they help themselves, they heal themselves, and then, they can kind of move forward in a way that maybe if that they felt like they had to talk to their OBGYN about, they never would, but so it's really nice to get that information out there.
And for listeners, what I can do as well is I can give you a free recording of the Golden Circuit meditation if you liked that and you just want to have it on your phone. So I'll create a little landing page for that, and then they can just download the recording of the meditation if you'd like.
Oh, that's wonderful.
They can all have it.
Yeah. Well, thank you so much. Thank you for joining Dr. Sara and Professor Sara today in our discussion about sex and sexual wellness. And I hope there's something that you heard today that will be helpful in your life, maybe a little takeaway, or perhaps you can reach out to Dr. Sohn and see how she can help you, or join her Facebook community, Better Sex by Sara. All of the information you need should be in the show notes. And don't forget to follow me on Instagram at Book of Lifeyness. Have a joyful and playful day and a restful evening.